In May, a rare case of monkeypox, a virus closely related to smallpox, was diagnosed in the UK.
That first UK case, which was from a traveller in Nigeria, is now thought to be unconnected to the wider outbreak, but the UK went on quite quickly to report many more cases.
Today, the UK has the globe's highest monkeypox case numbers, and the virus has spread to more than 4,500 confirmed or suspected cases across at least 40 countries, including the US and Canada. On Tuesday, the CDC said they are significantly expanding monkeypox vaccination efforts in the US. The agency also said it is now recommending vaccines for people with presumed exposure to the viral illness and not just confirmed exposure. So, how serious is the monkeypox outbreak? And should Americans be concerned about contracting this virus? Last month, World Health Organization officials said they expected monkeypox cases to grow, but stressed that the situation was containable.
This is a containable situation, particularly in the countries like where we are seeing these outbreaks that are happening across Europe, in North America as well.
This month, the WHO said that monkeypox doesn't, at this point, constitute a global health emergency.
They have said, however, that they might revisit that decision if the situation worsens. So, for example, if there was evidence that people were getting more severe disease, or if there was evidence that the virus was spreading into more vulnerable groups like children or people with weakened immune systems.
In the US, so far over 300 cases have been confirmed across at least 27 states and the District of Columbia.
Textbook monkeypox typically starts with flu-like symptoms. You've got a fever, headache, muscle ache, backache, and then a few days later you get a rash, normally starting on the face and spreading out, and it's a little like chickenpox. So it starts as these flat red marks, they become kind of pimple-like. But in the current outbreak, there have been lots of case reports of pretty different looking symptoms. Some people are getting no rash, some people are getting very subtle rashes. A lot of times people are noticing a concentration of the rash in the genital area rather than starting in the face.
Scientists believe the main way monkeypox is spread is by close contact. Previous research found that monkeypox virus particles spread over short distances via respiratory droplets. But it is unknown whether monkeypox can spread by tinier airborne particles, known as aerosols.
So there are high levels of virus in the pus-filled lesions that the disease causes, and contact with that is thought to be the main mode of spread. Monkeypox is much less easily spread than a virus that can be spread easily through the air, like COVID-19 would be an obvious example. But if you are in very close contact with someone, then it is quite easy to catch.
US health officials found that monkeypox cases are concentrated in specific communities. According to the CDC, at least some of the US cases were people who identify as gay, bisexual, or men who have sex with men.
The virus can infect anyone regardless of sexuality, but infectious disease experts think that the virus is exploiting very close contact between some members of this community to spread. This is the first time since the HIV epidemic of the 1980s that a newly emerging disease has cropped up and is concentrated in this community. One big difference between now and then is that while public health authorities were very slow to respond to the HIV epidemic, this time they are making a lot of effort to get the message out to gay and bisexual men. They're doing things like handing out information at pride events, they're sending push notifications on dating apps like Grindr.
Most cases of monkeypox resolve on their own without treatment. However, there are some antiviral drugs and a vaccine that were developed for smallpox that also work against monkeypox. On Tuesday, Danish vaccine maker Bavaria Nordic, which is the only producer of a vaccine licensed for monkeypox, said it will meet demand.
It's just like a traditional vaccine. It builds your immune system. It stimulates your immune system so you are better prepared to fight the monkeypox you are infected with.
Monkeypox was discovered in lab monkeys in Denmark in 1958, hence the monkey in monkeypox. That said, monkeys aren't thought to be the main vector or carrier of the disease.
Scientists aren't totally sure what species is the main carrier, but it seems to be very widely circulating among certain rodents in the rainforests of the Congo Basin in Central Africa. And the first human case was discovered in 1970 in a 9-year-old boy in the Democratic Republic of Congo.
In the current outbreak, about 4,500 people have been confirmed with monkeypox in countries where the virus doesn't normally occur, and none of those have died. Thus far, there's only been one death in Nigeria.